Hello, and thank you all for joining us today. I'm very excited to have some great guests to talk about what I consider kind of an active controversy. I'm Stephen M. Strakowski. I'm a professor and vice chair of psychiatry at Indiana University, and then professor and associate vice president at the University of Texas in Austin. And today we're going to talk about cannabis. As all of you are aware, everyone's talking about cannabis. We hear constantly on social media and in interviews, particularly with relevance to psychiatric disorders, that everyone should be thinking about using cannabis. And that seems to be the common conversation. I just last week had a patient who said, all my friends tell me I need to be on cannabis. That was their solution to her problems. So with that in mind, let me introduce our guests who are both experts on this to talk about, what is the role of cannabis in psychiatric disorders today? And so first, I want to welcome Dr. Leslie Hulvershorn. Dr. Hulvershorn is the associate professor and chair at Indiana University in Indianapolis, and Dr. Christopher Hammond, who is an assistant professor and the director of the co-occurring disorders program at Johns Hopkins. So welcome, doctors.
Thank you.
Thank you.
And so let's start. Leslie, as I mentioned, lots of people are talking about, how good a treatment cannabis could be for psychiatric disorders. Is that true?
Yeah. So if you look at what defines a good treatment, what you're looking for are studies that are done that we might call clinical trials, ideally randomized placebo-controlled clinical trials. And when we look at research related to cannabis, A, we see very few of those trials, and B, we see that the cannabis plant is actually quite complicated, and there's a lot of different compounds that come from it. So we have to look at all the different compounds. So if you think about THC, you might call it Delta 9 or Delta 8, depending on the version, but that's the active ingredient that most often we think about when we say cannabis. And if you look at THC studies, there really is no evidence that I could find. And I did do a double check yesterday to make sure I wasn't missing something new that came out, that it helps psychiatric disorders. What we do find is an enormous literature, many hundreds of studies actually that show that THC actually worsens or even brings on psychiatric disorders. There's a separate conversation about other compounds within the cannabis plant, like CBD, cannabidiol, where there's maybe a signal that certain anxiety disorders might be improved by something like that, compound like that. And certainly rare forms of epilepsy have been found to be improved with that compound. So it really depends on what you're looking at within the cannabis plant. But if we're thinking about THC, the answer really is no, this is not a helpful thing. In fact, it's probably a harmful thing to be ingesting in terms of psychiatric disorders.
Yeah, so thank you, Leslie. So Chris, what would you add to that? I mean, do we know anything about the use of cannabis in any psychiatric condition?
No, I mean, I definitely would echo what Leslie said. It's the popular opinion, the media, and sort of state legislatures have really, in many ways, put the cart before the horse here, and are speaking about cannabis as a medication for the treatment of psychiatric conditions, really before we have sufficient evidence to say that it's safe or effective for these conditions. And most of the evidence that we have, particularly with regard to the cannabinoid compound Delta 9 tetrahydrocannabinol, or THC, suggests that cannabinoid is associated with adverse mental health outcomes across different categories.
Yeah, and I know our group a long time ago did a study looking at first episode mania and found that in fact regular cannabis use increased the risk of subsequent manic episodes. And so that's something, again, but I'm not aware of a lot of other studies like that. Okay, so you referred, Chris, to the safety aspect. So again, people, if you look at social media and the press and the conversations, cannabis is talked about like there's no risk, right? That this is something anybody can use. There are no negative consequences. Is that true? I mean, is it really risk free?
Research really shows that that's an inaccurate framing of the safety profile of cannabis. Again, I think as Leslie put it very well, cannabis is a lot of different things, and so using this catch-all phrase of cannabis, I think, is not very helpful. But with regard to the main bioactive compounds of the cannabis plant, THC and cannabidiol or CBD, it's what we know from studies of THC administration and from medications that have been designed to mimic THC and act at the receptors that THC acts on, that those medications have uh, um, clear side effects and adverse events in a percentage of patients that take them, particularly with regard to precipitating panic attacks and dysphoric episodes and psychosis in some individuals. Um,
Yeah.
yeah.
Yeah, I would just add to that. It really depends on the age of the person that you're talking about and when they're exposed to cannabis. So, if you're talking about a person, say, under the age of 14, who uses cannabis, there's a lot of concern about the worsening of psychosis and mental health symptoms, but also things cognitive features like memory. There's a very good study done in New Zealand that followed a large number of kids over time and found significant decreases in working memory capacity for kids that used quite heavily. Then you think about pregnant women, right? So that's, to me, a very interesting literature where people are finding that cannabis not only affects brain development, but a host of other systems in the body. For example, I think asthma is increased. The risk for asthma is increased. And if you look at the genes in the placenta that are affected, it has a lot to do with the immune system, right? So women who are using cannabis during pregnancy are really exposing their fetus to a range of potential risks that we certainly don't understand well enough, but there's enough science that suggests this is really concerning. And then if you take a step back and look at animal models, even with things like CBD products, which again, everybody seems to be buying them at the drugstore and they're everywhere, right? And they're viewed as very safe. I mean, it's almost hard to find things without CBD these days. And there we find, like, for example, developing rats that they're the gonadal hormones, like, testicular development seems to be affected with high doses of CBD. So there's just a huge array of effects, even outside of the psychiatric world, that make me very nervous about anyone using, especially a pregnant woman or a young person. And then there's a whole separate literature on adults. It's hard to find studies that suggest this is a great idea. You're going to find worse, again, the mental health side of things, but the cognitive side of things, lots of effects as well. So, and again, I personally am, I guess, agnostic one way or the other. If cannabis turns out to be helpful, great. We love things that are helpful in medicine. We don't really care where they come from. I'm not biased politically one way or the other. It's just when you look at the totality of the literature, it's hard to feel excited about people using these really of any age.
Yeah, and it's difficult to interpret the literature because of some biases there. And it speaks to the importance of thoughtful research being done in this space that takes a neutral approach to assessing cannabis, looking for evidence of both potential benefit but also potential harm. Um, the other piece that I think is value to bring up that builds off of what Leslie mentioned is the effects of cannabis and THC. The risk for harm appears to be greater in pregnant women and in young people. And adults, I think we're also still trying to understand what the effects are, but the other way of parsing out effects and thinking about them are in terms of the acute effects and the acute response in the moment right after one ingests cannabis versus the long-term effects. And after acute ingestion of cannabis, it can precipitate someone to have a psychotic episode, dysphoria, or sort of severe depressive symptoms, or severe anxiety, um, and can cause one to be disoriented and have delayed response time and impact one's ability to drive. And in that capacity is related to a higher risk for motor vehicle crashes.
That's very interesting. And so in my practice, and maybe it's atypical, but half to 2/3 of my patients, particularly the younger ones, are using cannabis in some form or another. And in my experience, if they're under 21, they're more likely to use cannabis than alcohol. So what do we tell our patients? I mean, is there a safe level of use? Do we say never touch it? How do we manage the social pressure and environment that our patients have to live in?
Think about what we call motivational interviewing in the substance use disorder field, which is just a style of interacting with someone that's very neutral and, hey, what are the pros and the cons? And I guess in my practice, people are usually coming to us because of problems related to their substance use. Not everyone is experiencing those, but for those people, it's a pretty easy discussion. That sounds like you're getting into trouble. Your, athletic performance is suffering. Your scholastic performance is suffering. And you let the person on their own, you sort of walk them towards understanding that, wait a minute, if I smoked less weed or no weed, I would probably be doing better in this or that domain of my life. And so that seems to be the most helpful thing, is kind of allowing them to come to that conclusion. But I think it is a more difficult conversation for people who don't identify any problems related to their use. And, what is the right answer? But again, I just come back to, for me to say, I think this is good for you. It's hard to find the literature that suggests that. Is it neutral for you? Maybe for some people. Is it harmful for some people? Absolutely. So, and it's just hard. I think for me, the most impactful studies have been those that showed for certain people with certain genetic makeup, cannabis is an absolutely terrible idea, right? Their risk of psychosis development, things like that, are so high. And for other people, they could smoke weed all day and never have a problem, based on their genetics, maybe you could say. And we don't know. It's not like we're doing blood tests to figure out who you are. And so the safest advice, I think, is no use. I mean, that's never going to be bad advice.
I mostly agree with Leslie on this point, but feel very, very strongly that in this era where in the context of popular media and, as you mentioned, celebrities and other people stating that cannabis is good and should be put in everything, that clinical providers, especially pediatric providers, need to be extremely grounded in the science and not let popular media sway our approach and strategy for working with these young people. There's 2 decades worth of data from longitudinal studies that have followed individuals from birth or from pre-adolescence into their 30s and 40s that show us that this association between cannabis use and later adverse mental health outcomes, that there's a dose effect there, that the earlier an individual starts using, the more frequent they use and more persistence their use is over time, those individuals have poorer mental health outcomes compared to individuals who choose to abstain, or individuals who use just a few times and stop. There's also a signal for higher THC potency products being associated with poorer mental health outcomes, particularly when used during adolescence. And so I apply a motivational interviewing approach as well to disseminate this information to both the young people and their parents about the risks, and to communicate what the data clearly shows with regard to using THC-based cannabinoid products, is that we don't have evidence that shows that any use is healthy to the developing brain. Uh, and there's a lot of evidence that suggests that it's harmful to the developing brain. So the recommendation is not to use, to delay the onset of use if you want to use until adulthood. But a lot of youth choose to use, and for those young people, we meet them where they're at and try and work with them on cutting down.
Yeah, great. Thank you both. So there's an interesting effort going around the country in different states, lobbying and celebrities and legislators pushing insurance companies to fund cannabis use broadly, and including in a number of psychiatric indications with no FDA approval at this point. Do you all support that? Is that a good idea?
Absolutely not.
Thank you.
And I think that that's a very important statement to make, and for the medical and healthcare profession to stand strong related to states requiring insurance companies to cover medical cannabis. Really opens the door to legislation, to lawsuits that would force insurance companies to cover other under-tested bioactive chemicals and health supplements. There's insufficient safety data for medical cannabis, for FDA approval for any condition right now. The FDA has approved cannabinoid-based medications. Those cannabinoid-based medications have really undergone rigorous safety and efficacy testing and have been approved for very narrow indications, none of which are psychiatric conditions. They've been approved for chemotherapy-associated nausea and vomiting, treatment-resistant seizures related to two rare seizure disorders that emerged during childhood and related to tuberous sclerosis, and one related to treating multiple sclerosis-associated spasticity and central neuropathic pain.
Steve, I think it's important for listeners to be aware that there is a process in place for any therapeutic to become tested and reviewed. And we see an industry that stands to make an enormous amount of money. And that is really the motivation, right, for this industry. These are not folks who are out of the kindness of their heart just hoping for better treatments for people. There's many ways you could channel that desire. That does not include cannabis, making money. So it's really a profit motivated industry. They're very effective at lobbying, and this, the public unfortunately has been, I think, sort of manipulated by this industry to believe that these are healthy and safe and natural just because they grow, in the ground. And unfortunately, that's really the issue. And I think people just need to keep that in mind. Someone stands to make a lot of money off of this, and this is a very calculated, strategic approach that goes state by state, but is nationally organized and is potentially, like Chris says, for a lot of reasons, really harmful. I think I see it as sort of a bullying approach. Like if your drug works, Medicaid will pay for it. Medicaid will review, in each state, review the studies, and the FDA obviously leads the way. And to sort of cut the line without the research is really not helpful and circumventing the process that's been in place for a long time that works well.
Yeah, it sets a dangerous precedent.
Yeah, I was going to add the same thing, potentially dangerous. Well, thank you both, Drs. Hulvershorn and Hammond, for a really good, lively discussion. I know we could talk for a very long time about the situation. But I do think it's clear for listeners, most of whom are practitioners, that at this point in time, there just really does not seem to be strong evidence for the use of cannabis-based products for any psychiatric condition. And so I do think we have to approach the people we're working with around their psychiatric conditions to manage use and abuse wisely, like we would with any other substance. And so I appreciate everyone who's tuned in today to watch us. I hope this is useful for your practice, and thank you.